I want to talk to you today about something that affects a great many older adults who take medication for their heart. And that's the source of a surprising amount of confusion and misunderstanding. Heart medications, what they do, why they matter, and the common mistakes and misconceptions people fall into about them. Mistakes that can quietly undermine the very protection these medicines are meant to give. Because here's the thing, heart medications, when understood and taken properly, are among the most powerful tools we have for protecting an older heart, preventing heart attacks and strokes, managing heart conditions, and prolonging and improving life. But there are widespread misunderstandings about them, and getting those wrong for years can cost people dearly. So today I want to clear up the common misconceptions about heart medications, explain why taking them properly matters so much, and help you become a well-informed partner in your own heart care, working with your doctor. And I'll keep this calm and practical, because while this is genuinely important, understanding your heart medications and the common mistakes to avoid puts real power in your hands to protect your heart, in partnership with your doctor, who remains your essential guide. Let me start with the single most important and most common mistake people make with heart medications, because it's the one that does the most quiet harm, stopping them or taking them irregularly, once they feel fine. Here's the misunderstanding. Many heart medications don't make you feel different day to day because they're working silently to protect you, lowering your blood pressure, controlling your cholesterol, steadying your heart rhythm, or preventing clots, none of which you feel. So people reason, understandably but wrongly, that since they feel fine, they don't need the medication, or can skip doses, or stop altogether. This is one of the most dangerous mistakes in all of heart care, because these medications are preventing things you can't feel building: the gradual narrowing of arteries, the rising risk of a clot, the strain on the heart, and stopping them lets those dangers return, often silently, until a heart attack or stroke results. So the crucial thing to understand is that feeling fine on your heart medication usually means it's working, not that you no longer need it, and that you should never stop or reduce a heart medication on your own because you feel well. Instead, take it consistently as prescribed and discuss any changes only with your doctor. This single understanding, that heart medications protect silently and must be taken consistently even when you feel fine, prevents the most common and dangerous medication mistakes. So consistency, not feeling-based stopping, is the first key. Let me explain the second common mistake: stopping a medication because of a side effect, or fear of one, without talking to your doctor. People sometimes experience a side effect, or hear about possible side effects, and simply stop the medication on their own, which can be dangerous because abruptly stopping some heart medications can itself cause problems, and stopping any of them removes the protection. The better approach, always, is that if you have a side effect or concern, you talk to your doctor or pharmacist rather than just stopping, because very often the issue can be addressed by adjusting the dose, switching to a different medication in the same class, changing when you take it, or managing the side effects so that you keep the protection while resolving the problem. Many side effects ease over time or can be managed, and there are usually alternatives. So the second key understanding is that side effects and concerns are reasons to talk to your doctor, not to stop the medication on your own, because the protection matters, and the problem can usually be addressed while keeping it. Never abruptly stop a heart medication on your own over a side effect. Raise it with your doctor, who can adjust things safely. This keeps you protected while solving the problem, rather than abandoning the protection. So managing side effects with your doctor, not unilateral stopping, is the second key. Let me give you the third common mistake: not taking the medication correctly, the timing, the doses, the consistency. Heart medications often need to be taken in a particular way, at the right doses, at the right times, consistently, to work properly. And mistakes here: missing doses, taking them erratically, doubling up after a missed dose, or not following the instructions, can undermine their effectiveness or cause problems. With the number of medications many older adults take, it's genuinely easy to get confused or forget, which is understandable, but it matters. So the third key is to take your heart medications correctly and consistently, as prescribed, and to use the tools that help: a pill organizer to sort your doses, a routine that ties taking them to daily habits, reminders, a clear list of what you take and when, and your pharmacist's help in understanding the instructions. If you're confused about how or when to take something, ask your doctor or pharmacist rather than guessing. And if you miss a dose, follow the advice for that medication, rather than doubling up without knowing if it's safe. So taking your medications correctly and consistently, with the help of pill organisers, routines, reminders, and your pharmacist, and asking when you're unsure, is the third key to getting the protection your heart medications are meant to give. So correct, consistent taking with practical aids is the third key. Let me give you the fourth common mistake. Not understanding what your medications are for and why they matter, which underlies many of the others. Many people take heart medications without really understanding what each one does, why they're taking it, and what it's protecting them from, which makes it easier to fall into the mistakes of stopping them, taking them carelessly, or not valuing them. So a powerful step is to understand your heart medications. Ask your doctor or pharmacist what each medication is for, what it does, why you're taking it, and why it matters. Because when you understand that this pill is keeping your blood pressure down to prevent a stroke, or this one is preventing a clot, or this one is protecting your heart, you're far more likely to take it properly and value it. Understanding turns you into an informed partner in your care. So the fourth key is to understand what each of your heart medications is for and why it matters by asking your doctor or pharmacist, because that understanding underpins taking them properly and is your right as a partner in your own care. Don't take your medications as a mystery. Understand them, which both empowers you and helps you take them well. So understanding your medications is the fourth key, underpinning the rest. Let me give you the fifth area, the one that genuinely does involve working closely with your doctor. Medication reviews, interactions, and the problem of too many medications. Older adults often take several medications, sometimes many, prescribed perhaps by different doctors over time, and this raises real issues. Medications can interact with each other. Some may no longer be needed. Doses may need adjusting as you age and your body changes. And the combination, sometimes called polypharmacy, when it's many medications, can cause problems. This is a genuine area where things can go wrong over time if not reviewed. So the fifth key is to have your medications reviewed regularly by your doctor or pharmacist, a medication review, where they look at everything you take, including over-the-counter medicines and supplements, to check that each is still needed, that the doses are right, that there are no harmful interactions, and that the combination is appropriate, simplifying where possible. You can request such a review. Also, always tell any doctor treating you everything you take, including over-the-counter medicines and supplements, since these can interact with heart medications, and check with your pharmacist before taking new over-the-counter products or supplements. So regular medication reviews with your doctor or pharmacist and always disclosing everything you take are the fifth key, addressing the real risks of interactions and too many medications. So regular review and full disclosure is the fifth key. Let me explain why all this matters so much, because the stakes with heart medications are genuinely high. Heart medications, taken properly, are among the most effective things in all of medicine for protecting health and prolonging life in older adults. They prevent heart attacks and strokes, which are leading causes of death and disability. They manage heart failure, irregular rhythms, and other conditions. They control the blood pressure and cholesterol that silently damage the arteries. And they prevent the clots that cause catastrophes. So taking them properly genuinely protects you from devastating events and extends and improves life. Conversely, the common mistakes, stopping them when you feel fine, quitting over a side effect without help, taking them carelessly, not understanding them, or never having them reviewed, undermine that protection, often silently, and can lead directly to the heart attacks, strokes and crises the medications were preventing. So the stakes are high. Getting your heart medications right, in partnership with your doctor, protects you powerfully, while the common mistakes can cost you dearly. This is exactly why understanding your medications and avoiding these mistakes matters so much, and why it's worth becoming an informed, engaged partner in your heart care. So the high stakes make getting this right genuinely important. Let me be clear about working with your doctor, because that partnership is the heart of getting this right. Your doctor is your essential partner and guide in your heart care, and the goal of everything I've said is not to second-guess them, but to make you an informed, engaged partner who takes medications properly and communicates well. So work with your doctor. Take your medications as prescribed. Never stop or change them on your own. But bring any side effects, concerns, or questions to your doctor or pharmacist who can address them. Understand what each medication is for by asking. Have your medications reviewed regularly. Disclose everything you take. And keep your appointments and any monitoring, like blood pressure or blood tests, that your medications require. Bring a list of your medications and your questions to appointments. And don't hesitate to ask why you're taking something or whether it's still needed. That's good partnership, not distrust. If something genuinely concerns you about your treatment, discuss it openly with your doctor or seek another medical opinion through proper channels rather than just stopping. So the foundation is a strong partnership with your doctor. Take medications properly, communicate openly, bring concerns rather than acting alone, understand your treatment, and keep up reviews and monitoring. So informed partnership with your doctor is the foundation. Let me paint you a picture of how getting this right versus wrong plays out. Picture a man in his 70s on several heart medications, feeling perfectly fine. In the wrong version, he reasons that since he feels fine, he doesn't really need them, starts skipping doses, stops one that he thinks gave him a side effect without telling anyone, takes the rest erratically, doesn't really understand what they're for, and hasn't had them reviewed in years. Silently, his blood pressure and clot risk climb back up, and one day he has a stroke that proper medication might have prevented, the common mistakes having quietly undone his protection. Now picture him getting it right. He understands that his medications protect him silently, so he takes them consistently, even though he feels fine. When he has a side effect, he tells his doctor, who switches him to an alternative that suits him, keeping his protection. He takes them correctly with a pill organizer and routine. He understands what each is for and values them, and he has a regular medication review where his doctor simplifies his regimen and checks for interactions. His heart is protected, his risks controlled, and he avoids the catastrophe. Same man, same medications, but understanding them and avoiding the common mistakes, in partnership with his doctor, made the difference between a stroke and continued health. That contrast is exactly why getting your heart medications right matters so much. So informed, consistent, partnered medication taking protects you. And let me speak directly to those of you caring for or close to an older person on heart medications, because you can help enormously with getting this right. Understand that heart medications protect silently and powerfully, and that the common mistakes, stopping them when feeling fine, quitting over a side effect without help, taking them carelessly, not understanding them, or never reviewing them, can quietly undermine that protection with serious consequences. You can help by supporting consistent, correct medication taking, helping set up a pill organizer, a routine, and reminders, and helping keep an up-to-date list of everything they take. You can encourage them never to stop or change a medication on their own, but to bring side effects and concerns to their doctor or pharmacist, who can address them while keeping the protection. You can help them understand their medications by encouraging them to ask, or asking with them, what each is for. And you can help arrange regular medication reviews with the doctor or pharmacist, ensure all their doctors know everything they take, and help them keep appointments and monitoring. Supporting a loved one in taking their heart medications properly, understanding them and reviewing them with their doctor, while never stopping them alone, can protect them from the devastating events these medications prevent, in partnership with their medical team. So your support in proper partnered medication taking genuinely helps protect them. Let me draw this all together. Heart medications taken properly are among the most powerful tools for protecting an older heart, preventing heart attacks and strokes, managing heart conditions, and prolonging and improving life. But there are common, costly mistakes and misconceptions about them. The most dangerous is stopping or skipping them because you feel fine, when in fact they protect you silently and must be taken consistently. The second is stopping over a side effect or concern without talking to your doctor, when the issue can usually be addressed while keeping the protection. The third is not taking them correctly and consistently, which pill organizers, routines, reminders, and your pharmacist's help can fix. The fourth is not understanding what each medication is for, when asking your doctor or pharmacist empowers you and helps you take them well. And the fifth, a genuine area to address with your doctor, is interactions and too many medications, which regular medication reviews, and full disclosure of everything you take address. All of this matters enormously because the stakes are high. Getting your medications right protects you powerfully, while the common mistakes can lead silently to the very catastrophes the medications prevent. The foundation is a strong partnership with your doctor. Take medications properly, communicate openly, bring concerns rather than acting alone, understand your treatment, and keep up reviews and monitoring. So here's what I'll leave you with. First, understand that heart medications often protect you silently, so feeling fine usually means they're working, not that you can stop. And the most dangerous mistake is stopping or skipping them on your own because you feel well. Take them consistently as prescribed. Second, never abruptly stop a heart medication on your own because of a side effect or concern, but bring it to your doctor or pharmacist, who can usually address it by adjusting the dose, switching medications, or managing the side effect while keeping your protection. Third, take your medications correctly and consistently, using pill organizers, routines tied to daily habits, reminders, and a clear list, and ask your doctor or pharmacist whenever you are unsure how or when to take something. Fourth, understand what each of your heart medications is for and why it matters by asking your doctor or pharmacist, because that understanding empowers you and helps you take them properly, and is your right as a partner in your care. And fifth, have your medications reviewed regularly by your doctor or pharmacist to check that each is still needed, the doses are right, and there are no harmful interactions, and always tell every doctor everything you take, including over-the-counter medicines and supplements. Getting your heart medications right, in partnership with your doctor, is one of the most powerful things you can do to protect your heart and prolong your life, while the common mistakes can quietly cost you dearly. So take care of yourself, take your medications properly, understand them, review them with your doctor, and never stop them on your own. And because prescribing, adjusting, and reviewing heart medications require a doctor, please treat your heart medications as something to manage in close partnership with your own physician and pharmacist, bringing them your questions and concerns, rather than acting alone, and never stop or change a heart medication without your doctor's guidance.